Hypertension is another name for high blood pressure. Look around you, at least you know one person who has high blood pressure. Maybe your mom, your dad, a friend, or a sibling. Hypertension is very common. It increases the risk of you having strokes, heart diseases, kidney diseases, and even can increase the risk of death. The blood pressure is usually determined by the amount of blood your heart pumps out, as well as the resistance to the blood flow in your arteries. So if you have someone whose heart is pumping out a lot of blood with a lot of force, and there is also significant resistance in the arteries, then the person will have a high blood pressure. The World Health Organization has said that 46% of adults who have hypertension are actually unaware that they have hypertension, and also 1 in 5 people with hypertension have it under control. And you realize that it's also become a major cause of premature death worldwide. So there is a need for us to create awareness on hypertension. Despite a lot of research in the area of hypertension, the specific cause is still not known. However, there's been a lot of research that proves that it's an interplay of genetics, lifestyle, age, obesity, and other factors. And there are two main types of hypertension. So there's the primary and then there's a secondary type. For the primary type, we are saying that there is no cause, there is no identifiable cause. For the secondary type, there are certain conditions or disease conditions that you have that is causing the increase in blood pressure. Most adults with hypertension would have the primary type, and that one usually develops gradually over a long period of time. Although the cause is not known, there are certain risk factors that predisposes one to having primary hypertension in their lifetime. So obesity is one of them, high alcohol intake, smoking, those who have sedentary lifestyle. So all these people will fall under the type 1 or primary hypertension, where you don't know the cause. It starts gradually over a long period of time. There is also the secondary hypertension. As I mentioned, there is an identifiable cause. So people with kidney disease, people with thyroid problems, people with obstructive sleep apnea, and other medical conditions can also lead to secondary hypertension. So let's talk about some of the risk factors for hypertension. The first main thing would be age. We realize that as people grow older, their risk for hypertension also increases. Although now we are seeing a lot of young people getting high blood pressure, and it's been attributed to high stress levels and all that. But age is one main risk factor when it comes to hypertension. The other thing is race. People of African heritage have been identified at a higher risk of having high blood pressure in their lifetime. And also family history. You realize that there are some families that it runs through. Mother has hypertension, father has hypertension, daughter, siblings. That is the genetic component that we were talking about earlier on. So family history is a very important risk factor. And there are some other risk factors, obesity or being overweight. When you are taking in too much salt, when you are taking in too much alcohol, when you are smoking, all these things puts you at a risk of getting hypertension in your lifetime. So typically, hypertension or high blood pressure doesn't give any signs of symptoms. Even at levels that are very, very high, dangerously high levels, it doesn't show. It doesn't give you any signs or symptoms that will let you know that as you are walking around, you have hypertension. And that is why we are emphasizing that we get checked and we know what our blood pressures are. However, some people can start having symptoms like headaches, nosebleeds. Sometimes you can have issues with your vision. There can be difficulty in breathing. There can be chest pain. There can be that general fatigue and general malaise, not feeling well. So generally, hypertension is known not to cause symptoms or signs, but these are some of the symptoms that can also show up. So how do you know you have high blood pressure? It's simple. Anytime you visit the hospital, you realize that your vitals are checked. And one of the important parts of every vital checking is your blood pressure. So an instrument known as the sphygmomanometer is used to check. Now they are very common. A lot of people have it in their homes. There's the digital, there's the manual one. So once you check the blood pressure, it gives you two values. There's the value at the top and then there's the value down. The value at the top is what we call your systolic blood pressure. The one down is your diastolic blood pressure. The systolic blood pressure, the one up, it measures the pressure in your arteries when your heart is pumping blood out. And then the diastolic measures the pressure in between, so when the heart is more of resting. So the blood pressure readings, as we said, there's the top value systolic, the down the diastolic. And what we are aiming at is for us to get values of 120/80 or even a little less. That is fine. That is your normal blood pressure. However, there is also what we call the pre-hypertensive stage. That is a very critical period because once you check your blood pressure and you're within that pre-hypertensive stage, then you know there are certain measures you need to put in place to help so that you don't push yourself into the hypertensive range. So the pre-hypertensive, we're talking about anything between, for the top value, 120 and then 139. And then for the down value, we are talking about between 80 and 89. Now you move from that stage to your hypertensive stage. The hypertensive stage, there are two major stages. So there's a stage 1, stage 2. So anything between 140 and then 159 for the top, we say that you are in a hypertensive stage, stage 1. And then for the down, we are talking about 90 to 99. That is stage 1 hypertension. And then we talk about a stage 2. So that stage 2 will be greater than 160 for the top and then greater than 100 for the down. And these are very, very high values. So in diagnosing blood pressure, we don't use only one value. When you visit your doctor and we realize that the blood pressure is high or it's on the borderline, would usually let you sit, relax, and then the reading will be taken again. Or sometimes you'll be given a sheet to monitor the blood pressure over a week or more to conclude whether you're truly hypertensive. And then management can start. If the values are not too high, usually at the beginning of management, you don't go straight to medications. There is the possibility of lifestyle modification. So lifestyle modification entails a number of things. First of all, exercising. We encourage people that at least you should exercise 30 minutes most of the days in the week, to the point where you are increasing the heart activity and sweating most of the days in the week for at least a minimum of 30 minutes. Then for the diet, we are saying that you need to reduce salt intake. Reduce salt intake, reduce trans fats, cholesterol, and saturated fats in your foods. Do more fruits and vegetables, and reduce alcohol intake as well. And for smoking, it is a no, 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 no. So these are some of the lifestyle changes that once you're diagnosed of hypertension can be put in place. However, if these things fail, then your doctor will definitely have to move you to medications. And medications are very important for you to take on a regular basis and as prescribed by your doctor and the pharmacist. In conclusion, I would say that after watching this video, make sure you get your blood pressure checked. Know your numbers at least once or twice in a year. Enter a clinic or a pharmacy and get your blood pressure checked. Know your blood pressure, control it, and live longer. You can walk into any of the 3 branches of Sonotech Medical and Diagnostic Center, Osu, West Hills Mall, and Tema, and we are definitely more than ready to serve you. Your health is definitely worth investing in.